Legal issues in nursing related to informed consent can arise from various situations where healthcare providers fail to adequately inform patients about their treatment options, risks, benefits, and alternatives. Here are some examples. Failure to obtain informed consent. Nurses may face legal challenges if they administer treatment or procedures without obtaining proper informed consent from the patient or their legal representative. Think about communication issues, being rushed, etc. Lack of capacity to consent. Nurses must ensure that patients have the capacity to provide informed consent. Legal issues may arise if patients are deemed incapable of understanding the information provided due to factors such as cognitive impairment, mental illness, or intoxication. Failure to disclose risks and alternatives. Nurses have a duty to provide patients with comprehensive information about the risks, benefits, and alternatives to proposed treatments. Legal issues may arise if nurses fail to disclose relevant information, leading to patient harm or dissatisfaction. Language and cultural barriers. Nurses must effectively communicate with patients from diverse cultural backgrounds. Failure to address language or cultural barriers may result in misunderstandings and legal challenges related to consent validity. Documentation issues. Nurses are responsible for documenting the informed consent process accurately in the patient's medical record. Legal issues may arise if documentation is incomplete, inaccurate, or fails to reflect the patient's understanding and agreement to the proposed treatment. Emergency situations. In emergency situations where obtaining formal informed consent may not be feasible, nurses must act in the best interest of the patient while still attempting to obtain consent or involve a surrogate decision-maker as soon as possible. Legal issues may arise if nurses fail to adhere to established protocols for obtaining consent in emergency situations. Scope of practice. Nurses must ensure that the procedures for which they obtain consent fall within their scope of practice and competence. Legal issues may arise if nurses perform procedures beyond their scope of practice without proper authorization or training, even if informed consent was obtained. Review the attached article for examples of nursing interventions and the type of consent required.